So please introduce yourself, Julianne. It's great to have you here.
Thank you. Thank you so much for asking me, Emiliana. My name is Julianne Boutaleb. I'm a consultant perinatal psychologist, which means I'm a psychologist that specialises in accompanying parents therapeutically, offering therapy to individuals, couples, parents and babies from literally the start of their journey, where perhaps they're contemplating becoming pregnant or becoming parents, all the way through to supporting them until their child turns 5. I'm also a founder of Parenthood in Mind, and I have an 18-strong team behind me who can offer in-person and online sessions to anybody who needs therapeutic support across this period. And we're based everywhere from sort of Glasgow in the north through to Devon in the south, and there's a few of us in London as well.
Oh, thank you so much for that. And you do amazing work, and I'm a big fan
Thank
of
you.
everything you do. So I'm really excited to have you here. And we are focusing on one topic today, but I know there are many that we could focus on. But I was really excited to ask you to come for this topic, because I think it's something that people, hear the word and don't really fully understand if it affects them or if it doesn't, or, the things that are out there available to them to help them. Can you hear me okay? Because you've gone off camera, but don't worry Can you hear me, Julianne? I'll keep talking, see if we can get her back. But we're going to talk about tokophobia today, and why is it different from general birth anxiety?
Have you got me?
I've got you. I can hear you again.
Can you hear me and see me?
Yes, I can do both. Yes.
Okay, great.
So I was just doing a little talk over there about the fact we're going to talk about tokophobia, the general, how it differs from general birth anxiety, how common it is, how often you see it in your experience, the causes, and, if any questions come up, people might join us. We've got quite a few people signed up to it who will watch it on record, but we'll cover the general areas. So shall we start off with what exactly is it, and how does it differ from what you might call general birth anxiety, or you might call it something different?
Yeah. So back in the day, it was back in 2001 when I was actually starting out as a perinatal psychologist. A psychiatrist called Dr. Hofberg, working up in Liverpool, actually, she started to notice a difference in women that she was seeing at the time preparing for birth. And the difference for her was that this took on, very clear characteristics that were usually more like trauma than anxiety. And so there would be a clear avoidance around getting pregnant, really heightened anxiety to the point of being traumatized at the notion of giving birth, even going into a clinical setting. And the term at that time was tokophobia. And again, tokos is from the Greek to give birth, and phobia, as we know, in terms of things like arachnophobia or emetophobia. So these are really intense, morbid fears of the particular thing that we're talking about. And in this case, it's around giving birth. But to be honest, in my clinical experience, we see different versions of it. And whilst for some it is about the actual process of giving birth, for many it can also include fears around being a parent, being a good enough parent, fears around whether or not they'll be able to love this child in a way that they want to. So it can also be linked back to not just phobias or intense anxieties around the process of giving birth, but the transition to parenthood as well. So clinically, we differentiate between two types. So we talk about primary tokophobia and secondary tokophobia. And primary tokophobia is basically anybody who has intense fears around birth, pregnancy, and becoming a parent, who has not yet actually had these experiences. And so what we often find are these are potentially first-time parents. Sometimes I see them as they're going through IVF, or perhaps they've had a miscarriage, or perhaps actually they're at a point where with their partner it's clear they really want to have a baby but are absolutely terrified of being pregnant. And when we start tracing back in their history what might have led to this, it can often be around sort of intense stories that they may have overheard. Perhaps there's also a history of perhaps somebody in their wider extended family having died giving birth or become very mentally ill post-birth, so that they've imbibed stories about what becoming pregnant and birth involves, and that then leads to this intense phobia around getting pregnant. Unfortunately, in that clinical presentation, it can be very common for women to avoid getting pregnant at all, or indeed they might get pregnant and then have very intense fears about continuing with the pregnancy and then opt for termination. And I guess what I want to really stress here is this is often women who really want to be pregnant and stay pregnant. So it's a very distressing and upsetting experience for women who have primary tokophobia. Secondary tokophobia is different in that we're seeing women who have had previous traumatic birth experiences, and very understandably they're coming back round, perhaps after an emergency C-section or after a near death experience in a previous birth, and they find themselves pregnant again or contemplating becoming pregnant again. And what they start to understand is that actually they become very fearful around even having sex, for example, to get pregnant, or the idea that they have to go for antenatal appointments back to that same hospital, or they may also be gripped by the fear of potentially experiencing pregnancy loss again. So that's sort of a more common presentation, and probably the one that most of your listeners might be sort of knowledgeable about. But they are two very different presentations, and we work with them in very different ways.
When you say different ways, what would someone expect of that approach?
So depending on where the person is, so again, what's really important if you feel that your anxiety is taking on more of a form that would be likened to tokophobia, is to really clarify what it is that is scaring you or frightening you or putting you off or upsetting you. And for some, it might be very particular. It might be about going back into clinical settings again. There might be, for example, this week I've worked with a woman who's very fearful of the epidural, and we're doing very specific CBT type work around working with her fears and helping her with a variety of CBT type strategies to help her manage the fear. For others, it might be a more global set of fears. So it might be more about last time I had a difficult birth, I didn't really bond with the baby, breastfeeding was difficult, and this time it might be more about unpacking those experiences and what was difficult about those, and it might be more looking at self-belief. So what does that mean about you as a mother, and what is it about this second time experience that you might want to have different? And in that case, we might liaise with the pregnant person's medical team and ask for adaptations in their care that can be very helpful. Or we might also help them think about what type of birth they might want. For some women, as some of you know, there are nice guidelines now, and adaptations should be made where there is a diagnosis of tokophobia. And thankfully, some of the maternal mental health hubs that exist in the NHS, they involve very skilled workers who can help women who are currently pregnant and needing help around tokophobia. What's really important is that therapy will go so far, but we know, and I'm sure you'll be able to speak to this, Emiliana, that sometimes we really do need medical settings, maternity settings, to be able to adapt the treatment for these people. And sometimes the adaptations are very minimal, but they can make a huge difference. So one thing I'm thinking about is somebody who transitioned from a birthing pool, sort of midwifery setup, unfortunately, into an emergency C-section scenario, and really felt cheated of the sort of birth that she had envisaged for herself, and was terrified of the same thing happening again. So again, it was working with a midwife who was able to work with her fears, help her also things like being able to look at the options for birthing this time, whether that's a VBAC or potentially for some people an elective cesarean, but really giving people options in their care can also be a very important part of therapeutic intervention post tokophobia.
Yeah, and doulas can help as well, right? As well.
Yes, thank you. Absolutely.
Obviously,
Doulas
I'm
are
here to do that.
extremely helpful. Yes, yes,
Because the reality is the NHS is very stretched at the moment. And so,
exactly.
although the midwives, of course, that's what they want to do is spend the time and
Yeah,
adapt. Which I'm sure, that's what should be happening. But
yeah,
if people want that real one-to-one ongoing continuity, I'd really recommend
absolutely.
doulas. We have
Absolutely.
on
And
that.
I think the doula, is a very important part. And in fact, I often say to women who are looking, for their experience to be different this time, invest in a good doula. Yes, have some therapy, but it will often help them think about what they really need. And sometimes, yes, it's a certain amount of therapy, but it is also somebody who can work with them and their bodies this time round for a different outcome. So yeah, thank you for reminding me of that.
No, of course. I'm always here to remind about the doulas.
Yes,
Um,
definitely.
And in terms of partners experiencing alongside, perhaps it has been secondary, and so they've also been through an experience before and they're
Yeah,
worried. And what I see a lot is impacting birth options or
yeah,
preferences, I suppose, of what they should do versus what they
yeah,
feel safe to do, that kind of thing. Can you
yeah.
speak a bit to that as well, please?
Yeah, and again, what I want to stress is that for every case, this is very different. The outcome might be different. For one woman who, gets to have a VBAC, so a vaginal birth after a previous C-section, that might be an incredibly healing moment to be able to prepare with a doula, to prepare with us in terms of, helping her and her partner move through, to vaginal birth. And for another pregnant person we're working with, it might be actually really important to have an elective cesarean this time and to feel that actually what got in the way of bonding last time won't be there this time. So I really want to stress that for every person, it will be a unique set of circumstances that is really important to me and my practice, that, whatever it is that you need and you choose is going to be the right choice. Understanding, of course, that in terms of perinatal mental health, you're always weighing up, you're always balancing, the pros and cons, I guess, of potentially going through a vaginal birth again, where perhaps you don't have the support, where perhaps in terms of mental health, there is a risk to you becoming traumatized again. So we're always weighing up the risks and the pros and cons, if you like, both in terms of physical health, but also mental health. And again, that's a balance I think sometimes that is not looked into. Thinking about balance, what we have to also own is that in the absence of the village, in the absence of the extended family, the partner is often the village. And time again, particularly during COVID, actually, the partners were often overlooked as a source of support. In fact, they were definitely excluded from key moments of birthing during the pandemic, which had huge knock-on effects on both their, ability to support their partners and also their own bonding with their children. So I can't stress enough that it's really important that if you're working with an individual, that you work with the couple, that you really think about how the birth might have to be different for both people involved. I think what also happens is that the partner is often overlooked by the medical team. The fact that they may be suffering vicarious trauma is not thought about, in terms of the fact that often they see very graphically what may have gone on. And there can be, cultural and sort of gender expectations that they man up, stuff the feelings down, that they're there to support their birthing partner, and actually they shouldn't be talking about their feelings. And I have provided some quotations and sort of expertise to some articles on that as well. So I'm very happy to send that through afterwards. But we are seeing a rise in birthing partners being traumatized by birth as well. We reckon it's between 1% and 5% currently, but I would say that's a huge
Yeah.
under estimate. because a lot of people don't even realise they've been traumatised until much later.
Yeah, I'd agree with that, unfortunately.
Yeah,
And yeah, I think obviously we haven't got that long on here, so we could talk about it so much more, but it's just really just
yeah,
to say that it's important that partners have help with this too.
yeah,
If you're watching this and you're feeling like tokophobia might be something that you're wanting to deal with.
yeah.
Can we talk a little bit about how people, so maybe perhaps about how your approach to support, the type of therapies, is it one particular one you recommend, or are there a range?
No, there's a range, and again, I'd like to direct people to two websites actually. So Make Birth Better is an organisation I've worked very closely with, and they do some fabulous leaflets, even to the point. So I've written a lot on how your baby can be impacted by trauma, and I know that's an aspect of sort of tokophobia and secondary tokophobia in particular that people are often really worried about talking about. But what you also have on there is almost a script that you can take with you to the GP or to your obs-gynae team to say, this is what I need and this is why. So it sort of offers you a way to talk about the sort of needs that you may have second or third time around. So I just want to point people in that direction. But in terms of treatment, there's a couple of guidelines we have to follow. So if somebody, for example, is in their third trimester and they believe that they are suffering from secondary tokophobia, it would be really amiss of us to sort of start unpacking everything that they've been through. They're weeks away from potentially giving birth. So in that case, we might do CBT, we might offer EMDR. We also offer what's called virtual exposure, which is a way of sort of getting people to walk themselves through the scenario that they're imagining. And along the way, whether we can practically address certain issues such as how the medical team speak to them or how consent is gained, etc. That might be one approach. And we also involve the partners in terms of teaching them, techniques of managing anxiety, being able to advocate for oneself, and noticing when either person in the partnership is potentially becoming overwhelmed. So we call that virtual exposure. And so we really offer a wide range of techniques. However, if somebody has come through and they're contemplating getting pregnant, not yet pregnant, then we might unpack more of what's happened and listen out for themes, listen out for ways in which the experience perhaps dovetails with earlier experiences of not feeling listened to or well held. And of course, as you can imagine, both culturally, racially, and also in terms of sexuality, people are bringing experiences with them that will also dovetail with their birth experiences, the sense of being discriminated against or being boxed into a heteronormative framework that doesn't meet their needs. So we really listen carefully. We're also really proud of the fact, like yourselves, that we work with a whole range of people who are birthing and people who are pregnant. And we really understand that in the wider sense. So I would say anybody reaching out to us and in terms of therapy, it would depend on where you're at in the journey. We would be hoping to include you as the birthing person, but also your partner. We would also be able to do, for example, postpartum, if there was concerns around bonding. We could also think about that with you in terms of how your experience of trauma and having a difficult birth is now getting in the way potentially of you bonding with your baby. So we offer parent-infant work as well. So hopefully get the feel for the fact that really we tailored the treatment to the person and to their particular needs and experiences.
Yeah, it's an incredible service. Thank you for explaining all of that. This is a question someone did ask me ahead of this, but I don't know if it's going to be answerable. But
Yeah.
how long does it take to, I suppose, overcome the feelings of tokophobia?
Oh gosh, that
If you have,
really is a difficult question to
yeah,
answer, because it would really depend on you and your history. So
yeah,
as a rule of thumb, what we would be talking about is, we talk about standalone trauma. So if you've had one experience of this, and it's, well, let's say you have otherwise a very good history of seeking help and support, and you have a supportive network around you, and you don't come with, you know, a trauma history, it is possible to actually get through these feelings quite quickly. So in a matter of weeks, I would say.
Mm.
But the other side of that rule of thumb would be that the more cumulative trauma that you have, so the more traumatizing events that you have across your reproductive journey, whether that's pregnancy loss or having to use IVF or, you know, anything of that type, unfortunately, what we then see is a much more complex presentation. And then if you add to that perhaps somebody coming with a history of trauma, perhaps medical trauma, or indeed, and unfortunately, child sexual abuse or other types of childhood trauma, then that again can impact both the presentation and the complexity of the presentation, and also the recovery time. But it would be really unique to each person. Alongside the risks, we're always also weighing up the strengths and the amazing resilience that people can bring as well. So often it might look as if this is going to be a complex presentation, but this person has lots of supports to draw on, and yeah, that's important to remember as well.
And the most important thing is starting, isn't it? Like
Exactly.
got to get started and go from there. But yeah,
Yeah,
thank you for that. I know that's a hard question to answer.
it is.
But it is, yeah, I guess it's also, you know, don't wait in your pregnancy. If you know that you're
No.
struggling and you think, oh, it's better to do it later on, or it's always good to get the support early on.
I would echo that, Emiliana. I always say to people, I talk about the trauma cupboard, and it's a little bit like you might know that you've got a particular cupboard at home that you really need to sort out. It's there, it's in the back of your mind, and you think, oh, I'll put it off, I'll be fine, I'll put it off. But actually, that the research shows that the earlier you're able to get the support that you need, and again, tailored support, trauma-informed support, means that you get to that cupboard and you start taking stuff out. Yes, but it will be done in a timely, tailored fashion. And that's why it's really important to check out who you're seeing if you are approaching anybody for trauma support. It should not be the case that you are unpacking lots of traumatic issues if, for example, you're only weeks away from giving birth. That is not what is needed. So it's really important that you check out that whoever you are seeing has experience of working with trauma, and understands that, you know, the most important thing is session to session is that you feel steadier when you're going through sessions, that you're feeling more empowered as you're going through sessions, not that you're feeling worse and worse and more destabilized. That is not appropriate. So yeah, it's really important that you understand that a good psychotherapist or psychologist who is working from a trauma-informed lens will help you deal with some of the difficult things that you're going through, but will also give you the coping mechanisms and the tools to deal with those. It isn't just a case of peeling everything back and leaving you vulnerable. That's not appropriate in perinatal settings.
And can people access support through the NHS, or is it generally privately?
Absolutely. No, thankfully, in the last few years, maternal mental health hubs have sprung up in different regions. And again, it depends postcode to postcode what's available. But this is a specific service that has been designed to basically offer help at the point where people are contemplating another pregnancy or are currently early days pregnant. And they're usually mixed teams of psychotherapists, CBT therapists, midwives, also specialising in hypnotherapy, for example. And it's really important if you're contemplating getting pregnant, or even just very early days pregnant, that you ask your GP for a referral to the maternal mental health hub. It's really important because they do really, really helpful work, and they can often advocate and liaise with medical teams on your behalf as well. The other thing I would say is if you have health insurance, it might be worth taking a look at ourselves, Parenthood in Mind. We also operate with all of the main health insurance providers. And we also work with a lot of independent doulas, independent midwives, etc. So we're able to provide wraparound care as well if it's needed. But do check out with your GP whether or not you can get a speedy referral to a maternal mental health hub.
Yeah, that's brilliant, and probably worth doing both in conjunction, even if you are going to
Definitely, definitely.
Because later on, when it comes to
Definitely.
first options and
Exactly.
if you're with that team, it does make it a lot easier to have those
Definitely.
ears open. Yes. Oh, thank you so much, Julia. I told you the time goes so quickly. We could talk all day to you, and I'd love to welcome you back in time when you're able to come back to cover more topics.
Definitely.
So we'll post this. I'll post the links that you've mentioned. You
Thank
mentioned a
you.
couple of articles. I'd love to include those too. And we also post this on YouTube as well, so people can have a look.
Fantastic.
We come back to both your website and the Pregna Hub too.
Fantastic. Thank you so much. Thanks, Emiliana.
You're welcome. Thank you. Have a good rest of your day.
And you. Bye-bye.
Bye.